Hello, and welcome to episode 4 of Inside Suicide. This episode will explore the tensions and expectations between families and institutions regarding the memorialization of suicide deaths. I will be one of your moderators today. My name is Suzanne Bailey. I'm a social worker and National Development Lead for the Road to Mental Readiness, Mental Health and Resilience Training Program for the Canadian Armed Forces. And I am joined by my co-moderator, Henry, today, who will introduce himself and the rest of our guests.
So, hi, I'm Dr. Henry Bowen, and I am the Research and Training Lead for the Hospital Research Foundation Group Military and Emergency Services Health Australia, based in Australia. And I'm going to hand over to the first of our two guests, Claudine, to introduce herself.
Hi, my name is Claudine Barrette. I am a clinical psychologist. I am also the National Clinical Advisor for Wounded Warrior Canada. I co-developed with my colleague Caroline Turner a program called Surviving Family Program, where we welcome spouses and family members who lost a loved one on the line of duty, including suicide.
Thank you. Thank you so much, Claudine. And I'll hand over now to Matthew to introduce himself as well.
Thank you. My name is Matthew Barrett. I'm a historian and artist. I'm currently managing editor for the journal Canadian Military History. I've done a postdoc at the Canadian War Museum, a postdoc at the University of Saskatchewan, and I study honor and disgrace in the Canadian military. My most recent book was called Scandalous Conduct, about officers' courts-martial. And I've done research on the memorialization and commemoration of suicide in the First World War and Second World War.
That's great. All right. Thank you, everybody, for joining us today. And then I think Henry will get us started on the theme for today.
Yes. So as Susan said earlier, we are focusing on postvention and memorialization following a suicide death in today's podcast. So when someone dies by suicide, it affects families, colleagues, the broader community in really profound ways. But for military, veteran, and public safety context, these deaths are further complicated by occupational culture, institutional procedures, and public expectations. With all of these layers in mind, I would like to turn to our guests to ask what makes postvention and memorialization such a complex issue within these contexts. And I'm going to hand over starting with Claudine and kind of tap on some of that work that you've been doing with Wounded Warriors around your support for bereaved families. How do you feel that families experience grief after a suicide death? And what does it look like when grief is meaningfully acknowledged?
Yeah, what is important to understand is that this is a really specific grief, the grief by suicide. They are often sudden. There is also a component of violence. And we have to hide that sometimes the loved one, they are part of the discovery. Then is that this part of traumatic stress is embedded with is a typical grief. Then what we hear in our program is that the participants describe a lot of numbness, dissociation, which are symptoms that we can be related to any kind of trauma, intrusive images, thoughts, and they will say as well that it can change their vision of themselves, their loved one, the world. It's a big shock for them, and it's connected to a lot of emotion. I'm going to highlight guilt because this is what we call the what if, when there is a death by suicide, people ask themselves what I could have been done differently. What about if I have done that? And there is this kind of investigation that sometimes they start about what they could have done differently, which is really typical with the grief by suicide. They really need to make sense of what happened and why it happened. And they will talk about the fact that they have a loop of conversation inside their mind, intrusive memories, everything that can connect it to some specific traumatizing experience. They will come as well with anger. They say this is really hard to process as an emotion. They will say that what I do with my anger toward a person completed a suicide. They also have, and I think it's important to know for the organization, sometimes the anger is going to somebody else, like the mental health system, sometimes the organization. And they also describe a lot of fear and hypervigilance about what about if it's happening to somebody else. And I think the organization, they also carry this fear because the contagion possibility is real, especially when you have a group of people who have been suffering from the same experience. And we know that trauma exposed professionals are exposed a lot. Then the family, they have a fear that, especially I would say with their children, that they also have this kind of thoughts about suicide. But I can feel as well that the organization, they care for the other member. Then it's a complicated grief, and sometimes family will say it's like if we don't have enough resource, because it's touching everybody at the same time in a really deep and painful way.
And I can hear that, like, the fear, the grief, the anger, the loss, and how the lack of resources or the perception that those resources aren't there for them is really impacting them. What would it look like in your experience, or have you seen experiences of when those resources and that acknowledgement was done really well and someone felt like that was something that they got support from?
Yeah, I would say that the first thing is that the resource, they need to be attuned with what the family they needs. The family, they describe a lot of contradiction in between what they feel, what they need, what is the culture of their family in terms of what they want, and this other level of what the organization they need to do. Then and I had some participants who describe positive experience, and what they say is that we feel that we have been part of the decision of the process from the beginning. Sometime when some pieces were hard, because sometime I understand that the organization, they need to take decision because this is sometime a public debt. But when it's explained to the family, when they know why it's going to be like that, when they feel that there is a space of compromise. And I think as well, what is important is what we're going to call the layers, that you can have a layer that it's public, and you can have a layer that it's more private. And sometimes the private one can be just with the family, sometimes with the colleagues, sometimes the organization can also be part of that. I remember one participant saying, the organization allow us to have a small gathering before, where we could choose some of the colleagues, and we have been able to process some pieces before the big event that can be really overwhelming. Then when they feel that they are considered and they are, everything is explained to them, it's much easier for them to be part of the process. Yeah.
That's fascinating, almost providing that individual and personal opportunity to grieve before the more public opportunity to grieve within the larger organization.
Yeah, it's the before and it's also the after, because one piece that the family describe a lot as well is that there is a lot going on, during, the day after and sometimes the weeks. And, in the, some reaction can be like some people will feel frozen, on shock just after the event. This is really normal. And they will need weeks and months and years to unpack, because we know that anniversary and different kind of normal life event will kind of trigger the grief. Then, the before is super important, what we decide together, what we do before what is really official. And also the after, a lot of families say, I wish that they had stayed longer, some of them describe that sometime when the ceremony are really like in a short period of time and after there is nothing, they almost receive the message like, am I supposed to have already processed that? And they describe as well sometimes the discomfort that the people feel around a loss by suicide, the stigma. And one of the participants used an expression that really struck me, really touched me deep down. She said, it's like if he is not named anymore, like if this is a sense of my husband disappear. We don't talk about him because my husband became this guy that commits suicide. And one of the things that it's really positive that the people talk about, it's when their loved one is acknowledged for his service, for what he have done, as a father, as a spouse. This is what is the really important for the family, that they can still carry a legacy and be proud, and that the relationship is much more than the suicide. The suicide is a part of what I would say happened to this person, then they need time they need space, and they need people available to talk about it. Yeah.
Absolutely. So that the suicide is one part of that person's story, but doesn't become their whole story.
Yeah,
And
exactly.
so, yeah, okay. Thank you, Claudine. And Matthew, I was wondering from a historical perspective, building on what Claudine has described, how have institutions traditionally approached memorializing suicide? And as we were just talking about, how have those approaches shaped whose grief is legitimized, and whose service is honored?
And what Claudine said is so well said about the emotional aspects of suicide and the sort of feelings of families. So I'm just going to speak about the sort of institutional and historical attitudes. So suicide in the military is infused with a great deal of stigma. Going back to military law, it was criminalized. It was criminalized in Canadian society. There's religious sanctions around the idea of suicide. So there's a great deal of stigma that's sort of built into institutional attitudes towards suicide. And yet there's also such an importance of memorialization and commemoration of people who have died in military service. So there's a tension when someone dies by suicide, and how does the military respond? Sometimes historically, we have this idea that it's an arc that moves straightforward from ignorance to enlightenment. We think that maybe attitudes in the past were more harsh or less forgiving than today. My research has focused on a lieutenant colonel in the First World War named Sam Sharp, who had served on the Western Front and suffered a breakdown. And when he returned to Canada, he jumped from a hospital window and killed himself in 1918. In that sort of one example, we can see how at the time, in this First World War wartime context, his death was very much incorporated into the mourning and commemoration of all military deaths, that there were newspaper obituaries at the time. Speakers were talking about his death as if it was a battlefield death. So they were using that language of self-sacrifice and soldiers willingly giving up their lives in defense of their country, and incorporating his suicide death into that sort of into that language and that commemorative structure. But that's sort of that's one example. But you can sort of see that there's still a tension even built into his commemoration, that people are saying it's as if he died on the battlefield, and that as if indicates that there's still a distinction between a military-related death, a wartime death, and a death by suicide. And going forward, into the interwar years, into the 1930s, there's a shift in his memory that it becomes more hidden, and it becomes sort of more forgotten, because this has become a story of tragedy that people don't really want to confront and acknowledge when it comes to the commemoration of the war, of the great deal of death and suffering that happened. People wanted to create narratives of willing sacrifice, but also soldiers who had sort of happily given up their lives, willingly given up their lives. And you can see how a suicide death is sort of fits uncomfortably within that framework that they wanted to create. And I would say, sort of with commemoration generally, there's a tension that historically one of the purposes of commemoration of wartime death or military service death is to create narratives of inspiration. The idea that by remembering those who had given up their lives, for instance, in the First World War, that inspired people to enlist in the Second World War. So it's sort of inspiring people to follow the example. With a suicide death, that's exactly the reaction that we want to avoid. That we, as Claudine very well talked about, this idea of contagion and triggering suicide ideation in others. So within the entire concept of commemoration itself, within a military context, you can see that there is this underlying tension between wanting to commemorate, but then also not wanting to provoke contagion and sort of allow families to grieve the death of their loved one, but also wanting to put sort of controls on how that grief is going to be expressed from an institutional perspective.
Can I add something about that? Because it's okay, because Matthew, I have been really touched about what you said, as if,
Mm-hmm.
This nuance in between the real line of duty death and the suicide. And I think it's really important, this as if, because we had a lot of conversation when we created our program around that, because we were aware that for some people it's not a real line of duty death, and I think it's really harming people. This is what we think. Sometimes I feel that it can almost feel like an investigation, what is the real reason of suicide. Like if it's a simple thing, we know that this is complicated, this is an accumulation, and from my point of view, I want to acknowledge the suffering of the people who serve. They can be military, they can be in public service, they can be, first responder. We know that they carry a lot. The family is also making some sacrifice, because, sometimes there is deployment, sometimes there is the father, the mother being away, for some investigation if they are police officer. And I think the family, they deserve to have the best care, the one that they deserve, and to not make this tension in between type of death. I think this kind of investigation is harming people. And I really want that we stop arguing this, For me, as a psychologist, I want to include everybody suffering. And the way that I see that is that a grief is in the center, and then there is this layer of suicide. But also there is another layer that it's like, if the person, that you lost by suicide was a police officer or another kind of first responder, military, there is also the vision that these people, they carry, like a hero. My father was a police officer. My father saved people. And then he committed suicide. Then if we start to question around that there is already so much in their head, then when the ceremony, they can respect and give the same sense of respect to everybody. I think it's really helpful in family.
I would agree, and you've both touched on some of these really sensitive tensions that organizations face when trying to support the families through postvention and, balance appropriate memorialization. And so I'd like to ask you both, where do you see the greatest opportunities for change to better meet the needs of those who are affected?
Well, I think, as Claudine said about this idea of investigation, which points to this question of attribution, which historically has been very important for the military deciding which deaths are considered military related in a wartime context, which deaths are considered as wartime casualties, and then which aren't, and how that plays into the type of memorialization, type of commemoration that happens. I just want to sort of maybe briefly discuss historical case as sort of a contrast to what I was talking about with Sharp. Into the 1930s, decades after the First World War, there's still people who are suffering from injuries and wounds that they had incurred during the fighting. But now we're beyond a wartime context. We've moved into a different language of commemoration, and there's an example that I've written about before in the 1930s of a veteran who is in the permanent force. He's in the regular army. He suffers a breakdown, is hospitalized, and he tragically kills himself. And his service record details the struggle that his widow went through to try to get him acknowledged as a wartime casualty. This is happening almost 20 years after the First World War, but she's linking his suffering to what happened during the war, and there's this bureaucratic struggle that she's going through, dealing with her own private grief, but also having to deal with the military bureaucracy that wants to acknowledge his death as something that's separate from his military service. Questions about from the wife about who's responsible for this case, and so there's this. It's an amazingly detailed back and forth between this woman who's extremely forceful and relentless in pursuing the legacy on behalf of her deceased husband, and eventually she succeeds, and the military acknowledges that his death was a wartime casualty. He's honored as all First World War military dead are honored with a standardized tombstone. And she receives the Silver Cross, and so it's a success in her case, but it was a great struggle for her to try and get that recognition. And there is plenty of examples in the historical record of that not turning out, and it's been exacerbating the tensions and the grief that the families feel. So I think if we look back to the historical record and see how memorialization of suicide isn't simply just from ignorance to enlightenment, that somehow we're more enlightened today than we were in the past, but see how it sort of ebbs and flows. It's very much context specific. It's about the situation. It's about attitudes and how attitudes shift over time. And I think if we can learn from the historical record about the struggles that families are put through when they have to deal with issues of attribution, I think that would be a good place to sort of move beyond the bureaucratization and administrative challenges that people would face when a loved one dies by suicide.
And again, I want to add what you said so beautifully, Matthew, when you said get the recognition. And I think this is what we should fight against. People should not have to fight to get the recognition, that the recognition of the suffering of the people and the sacrifice is recognized. You talk as well about the bureaucracy, and of course there is all the process around, the ceremony and everything after the death. But a lot of our participants, they talk about everything else that you have to do regarding the work. And as we are also looking for some solution, we realized that the one that they had a person that was a point of contact for everything was really helpful. Some organizations, they provide that. They say, this person will be your point of contact for everything. This person will obviously not have all the response or the solution, but she will be or he will be in charge of finding it. And I think it was really helpful. I will say that for me, what is really useful is, as I said before, I just want to highlight that the family are part of the different step, and also that they are given option. I understand, I work with first responder and military people since 25 years, that the organization, they have rules. And you talk about the Silver Cross, the military, they have their rules, and the other organization, they have their rules. But I think it's about communication, and that they are able to walk together and also help the family, give them option, because sometimes it's hard for them to make a choice. But if you give them option with what is possible, and you have, again, different layers of manners to acknowledge, the death of the person, I think it's really helpful. I think as well, it's really important, the words that we use. Some families, they talk about it, the way that the person is described, the loved one that dies described, the person that they lost, but also everything around, to be able to talk about it, even the suicide, with respect, not like to, again, that it doesn't sound like an investigation or something that you have to explain. But some family, for example, they describe that as it was so public, they talk about, for example, the father, and they almost didn't recognize what they said. It was such a small piece of him, that then they say that if we are able to be included in the way that they describe the person, it's really important for them. Yeah.
So, Claudine, it sounds like you're almost highlighting sort of that balance between organizational needs taking precedence over the family relational needs, and how do you balance that during this whole process of grief and commemoration?
Yeah. Yeah, it's really important, this balance. If I highlight a couple of pieces that I learned on the way, working with grieving families, that is the speed. They talk about the speed sometime, and the rhythm. Organization, they have to sometimes do it fast, and they are like, for us, it's such a shock. Then there is like that, the level of privacy versus what is public. We need to pay attention to that. It's I understand that there is sometimes some tension around that, but if we are able, again, to make sure that the family, they are part of the different step of the process, or at least being explained what is the next step. And
Absolutely.
yeah.
And I just want to highlight one of the other unique aspects with first responders is that it will often be somebody who is known to the member and the family who has to either respond to the call or make the notification to the family of the death. And I'm wondering if that's something that either of you has encountered in your work.
In my work, I've looked at so I've looked at court-martial cases, and there are examples of there's one particularly really tragic example of an officer who discovers the body, and the sort of the impact of that on himself and his later unrelated misconduct that sort of resulted from that trauma. There are also examples. One comes to mind of an article from my journal, Canadian Military History, from a couple of years ago by a historian named Eliza Richardson, who looked at the reactions to suicide in the Canadian military during the Second World War. And she has one very striking example of a commanding officer who has to notify the family of someone who had shot himself and killed himself. And this officer decided to conceal the circumstances of the death, of saying it was an accidental shooting rather than a suicide death. And you can see how that's sort of um, inspired by a sense of compassion, of not wanting to burden the family, but it's also deliberately lying about the circumstances. And later in the article, she talks about that the chaplain who has to go to the family, as was common at that time, about notifications of family and sort of how the military tried to manage family's grief, was quite upset about the fact that he had to break this news, that they already had gotten an indication that it was a suicide death, and just points to the confusion and the tensions that can result when from what someone might think of as an act of compassion, of concealing the circumstances, in fact does the opposite. And so I think, as Claudine rightly talked about this importance of the language that we use, it's a very difficult thing to talk about, and it's a very difficult thing of knowing what to say and how to treat people compassionately, but also honestly. And I think that's a good lesson historically to take, that we need to find the language to speak about these issues honestly.
And if I may add about that, I did a lot of post intervention for more than 10 years, and I work with small communities, and this is really frequent. The person that will have to handle the situation, is known, by they both know each other. And then, for example, if a police officer is going on scene and it's another police officer that committed suicide, will have to talk with the family. And if you work with small communities, they know each other a lot. Then there is, I would say that there is the person in the center, the family around, the community, for example, of police officer around this person, that then all know this person, and also the community of first responder around this person, that they work together, then they have a sense of connection, then everybody is touched at the same time at different level, but you have sometimes a community who is grieving at the same time, a large group of people with different level. And of course, Matthew, you highlight the situation with military, with the military, they work as unit, they work together, they move a lot. Then when somebody died, it's touching so many people, and people that sometimes have to intervene around the scene or around, what is decided after they know this person, then it's making it harder.
Definitely.
And I heard that from some first responder. They say, I'm supposed to go to places where, I don't know the person, or I know them from far away, not to go to get my colleague body.
That's right. They don't anticipate having to do things like that. Yeah. And Henry, I know you've done some work in this area, and I'm interested on your perspective on this as well.
Yeah, I was just going to say, it's interesting coming also from a bit of an Australian perspective, to hear the echo of the same stories across countries, connected by this sort of both shared grief, but also shared profession. Something that we've been hearing a lot of, in some of the work we've been doing in first responders in Australia, looking at that post-vention space, is in that grief is cultural. We already know that grief is cultural, but that first responders and military are a unique cultural group, and that's not something that's restricted to just those in the profession. The family is part of that cultural group. The community is part of that cultural group. So when we think about grief and ways of grieving and ways of memorializing that grief, there are some rules around how that happens, and it's very interesting to hear how that is so similar and so layered, even from an international perspective. Some of those layers around attending or potentially the door that is being knocked on is a door that has been visited many times in very positive circumstances, a child's birthday or even carpooling to work. And now that person, that you are potentially giving the worst news they've ever received in their life is someone, that you know quite strong and quite personally. And it's that family that is not necessarily a blood or marriage, but that family of choice and culture that sits sort of behind that as well. And the historical lens, I think, also to give some of the things you were saying, Matthew, we've certainly heard of that when you're in the military, that unit as family, as well, that extension of how the community impact kind of comes along. Um, it's in some ways really comforting to know that this is a shared experience even beyond international borders. But at the same time, it shows that gives us a lot of space to learn from each other and build on that kind of greater knowledge across the different borders. And it makes me kind of call back to something, Claudine, you mentioned it earlier, and Matthew also from that historical lens you were talking about it, about we've heard a lot in Australia around that post-vention responses being no leader wants to do a poor job. Everyone wants to respond well. And military and first responders are built for critical incident response. That's what they're there for. So they tend to handle the immediacy of a situation. They're kind of trained to snap into action and respond to what they're seeing and doing. But it's that kind of the history, that long-term stuff. They know what they're doing in the moment when they're really responding. The longevity of it is when reality starts to set in. I think you said it really well earlier, Claudine. It's that point of contact, someone who can help communicate when maybe it's 3 months, 6 months later, but actually now that's where the support of family is needed. I'd really love to know from both of you, when you're thinking from your perspectives, that short-term response is one thing when we think of memorialization. In Australia, we hear a lot about the support goes until the funeral. And then once the funeral happens, it's almost like everything starts to wash away. But we see in Matthew's work how long that tail can be as a historian as well. What do you think about this framing of short-term to long-term reality of when it comes to grief and bereavement in these unique cultural groups?
I think that's really well said, because it points to this idea of memorialization as being an event as opposed to being a process that takes months, years, and really is, in a sense, never ending. That sometimes this idea of commemoration is that there's one event, a funeral, a tribute, and then there's no follow-up. I mean, to return to my research on Sharp, that I think that's a great example, that there's this funeral that happens. He's returned from the front lines. He's died. It's a military funeral. It's one of the largest in his hometown. And it's sort of very well attended. And there's some tributes afterwards, and he's still well known in his local community for years after. But the memory of him very quickly fades. And by 1924, when Parliament is reconstructed and there's a statue that's created to honor the one Canadian member of Parliament who died on battlefield, Sharp's name, and he was a member of Parliament as well, his name goes unmentioned. And that the tributes to this other individual who died on the battlefield is presented as he's the only Canadian member of Parliament who's ever put on the uniform and given up his life. And this is only 5-6 years after Sharp's death, and he's now forgotten on a national level. He might be remembered locally for a while until his wife, who's really sort of spearheading his memory, dies in 1938. But on a national level, Sharp very quickly fades. And then to flash forward almost a century later, there's renewed efforts to commemorate him in the context of greater awareness of suicide in the military. So there's a plaque that's created that's going to be put in Parliament. And then to return to a point we sort of had talked about earlier about this idea of contagion and concern over how commemorations are sort of presented, that there's a concern from the government about having a permanent monument to Sharp in Parliament, and eventually the monument is moved to another hospital because Parliament's under reconstruction. But you can see that there's still this tension about a fear of provoking a contagion effect, and they sort of to think about the difference between a military service related death and how that's commemorated in a suicide death. Sometimes you see in guidelines that one of the things to avoid for a suicide death is a permanent memorial. Sometimes it's presented as it should be a temporary one, whereas that concern doesn't exist for a military service related death or someone in public safety who dies on duty. And so I'm wondering, like, how that can also be an issue in how memorialization is seen as temporary for suicide, and we're sort of forgetting about this long-term remembrance that needs to happen.
Yeah, I think it was so interesting as well how you just then discussed the separation between what was clearly the want of the family member around how he was remembered and what that looked like from their perspective versus what that institutional kind of, or even larger than the institutions, got sort of thoughts on what was appropriate and what wasn't appropriate was. And it made me think of what you were saying earlier, Claudine, about that balance between the institution versus the family. And we were kind of talking about it more in that administrative, sort of early stages, but with this added kind of context of like longevity, what are your thoughts on that as well?
If I think about longevity and how the support can continue over time, of course there is everything that is public, but I think from my point of view, what is really important is what is more private and can last over time. What the participant really appreciate is when, again, this point of contact person was doing regularly check-in. At the beginning, it can be once a week, or it can be decided with the family, what do you need? And sometimes to give a little bit more just to make sure, that they are not afraid to ask. This is what can be really appreciated because, in grief, we talk about waves of loss, then there is maybe a month that can be, easy, and then the next one is harder, and to also have some point of contact around dates, around some specific events. But I think this kind of intervention, they need to be done by somebody who is able to be genuine. It's not supposed to be something like to check on a list. It's more like somebody who care, who take charge of that, and is able to see what are the needs of the family. I think in general for grief, we tend to have process that they are too short for most of the family. I would say with suicide, because there is some discomfort, because people are also overwhelmed by emotion regarding that, because this is so difficult. I would say that our family who lost somebody by suicide say there is a lot of silence. This is what is really painful for them. Yeah.
So when people don't know what to say, they just don't say anything. And so then that feels like it's not being acknowledged or even accepted what's happened.
Exactly.
Yeah, which is almost echoing exactly what Matthew said as well, but like even on a larger scale, we don't want the memorial here, maybe it needs to be over here, the kind of essence of it being temporary, it's kind of those layers of lack of acknowledgement come through.
I think you can sort of see from what you just said is that even in attempting to treat suicide sensitively, suicide death sensitively, and how we memorialize, that itself also is implying a continued distinction. That, for instance, one of the guidelines to prevent contagion is to avoid glorifying the death. Well, that same kind of acknowledgement isn't, or warning isn't made for instance, public service safety deaths of someone who dies in duty or someone who dies in war. I mean, I think that it's important not to glorify, right, any death, and yet by sort of putting that warning specifically to suicide, even with good intentions, you're still implying that there is a distinction between that death and another. And so I think that one of the things going forward is that people really need to think about what is the purpose of commemoration, and like how do you balance the fact that we want to treat these deaths equally with the concern that there are special issues and sensitivities around suicide deaths.
Yeah, that creates another interesting tension. How do we treat it the same and still honor its uniqueness?
I think equal doesn't mean same, because for me, it can be treated equally. This is what we do in our program. But as we have different kind of line of duty death, we will treat them equally, but differently. I think the shame, the guilt related to death by suicide, it's something really more specific to them. I'm not saying that other kind of death, they don't have that, but this is really in the core. As I will say that, yes, the language is maybe important in some ways for all kind of death, but for this one, it's true that the good practice suggests that to avoid to glorify. When people start to say, oh, this is really brave, or the opposite, this is not really courageous, we will say that to avoid this kind of judgment is to stay out of judgment. We can acknowledge the pain, and I will say that as well. Maybe during, let's say, the second wave, it's not something that we're going to talk when it just happened, but for the organization to talk more about the fact that when we have pain, we can get support. This is what the good practice are suggesting, to say, yes, when there is pain, when you feel that this is too much for you, you can get support, but this is not something that should be done, around the family at the beginning. This is not like that. But of course, we need to avoid to glorify suicide because, especially in a group, again, suffering from the same kind of trauma or difficult experiences, we don't want to have more suicide in the same unit or in the same group. But for me, they are two different processes. There is connection in between, but I think they need to be different, as well. What we do now to take care of our other members and the family members as well, because we know that we can have contagion inside the family as well.
Absolutely. And I'm wondering if either one of you has come across examples of when this has been done really well, sort of what some of the best practices might be that you've come across in your experiences, both historically, but, in your work with families that we could learn from, and things that could help guide and shape the whole memorialization process.
Yeah, the good practice, if I try to summarize, we'll talk about, again, I repeat, but to have a family informed memorials, like that they are built together, option, that they are meaningful for the family, but they are meaningful as well. This is a mix of culture. For me, it's a meeting of two culture, all the family and and you talk about the culture of first responder and military, but they also have a specific culture for each group, especially if they are from this part of the country. It's all different. Then we need to have this meeting and discuss together. And I think as well for the good practice, I want to highlight that it's about to know how to talk about it, to talk about suicide, to talk about how painful it is without glorifying, but also acknowledging the pain of the family and acknowledging the pain of the person who completed a suicide. then this is what, there is probably more that now I cannot remember, but this is what I remember from the good practice and what we try to bring in the ground, you know. Mm-hmm.
Yeah, I think that's really well said. And I would just add about how sort of looking at this historically has really emphasized to me how memorialization is just such an individualized process that what might be successful for one family is not going to be seen as successful for another. And I think that for some families, it might be very important to see their loved one's death be incorporated into this wider commemorative effort around being part of the military or being part of a public safety institution. But for others, especially if they have challenges with those institutions, that might not be the case. It might not be that they don't want to see this death, in a sense, being sort of honored and incorporated within an institution that they've had significant issues with. So I think it's about creating this balance between what the institution needs to do to honor a service member who has died, but also acknowledge the importance of families, and that families are going to have different priorities and they're going to have different needs. And sometimes those two groups are going to be in tension. And I think it's very reasonable to say that the priorities of the family should really, I would argue, come first, I would think.
No, that's important. That obviously there's no one size fits all, but that respecting and honoring what the family needs in that moment is critical. And Henry, I was wondering if you had anything additional to add to that from your experience.
I was just again reflecting on how much this echoes back to the experience that we've been hearing from the Australian first responders, their families, from veterans and their families, and the communities that sit around them in the Australian context. This is almost identical to what we're hearing in the Australian context, and I think it really echoes back to something that you said earlier, Claudine, about communication. I remember speaking to someone in some of our work who was a spouse who said, in some ways I feel really bad for the organization because they're stuck between a rock and a hard place. They cannot get it right because what I want was not what was needed by his unit when he passed. And they could not give us both what we wanted. And it was a really interesting position to hear the spouse talking with such sympathy for the organization that even 5 minutes earlier was speaking with very opposite emotions, similar to what you were saying, Matthew. There was a lot of anger, a lot of blame. And so I think that it is not an easy answer, I think, to think of what comes next. But again, I kind of come back to that. It's nice to know that there is an opportunity, I think, to have this mutual learning, but also there's a comfort in not seeing the soloness, or it not feeling quite so lonely, to know this is a shared experience. And I think that kind of was some of that stigma that you talked about, Claudine, of it feeling like we're the only ones who have ever experienced this kind of the grief of loss attached to the everything else that comes with specifically a suicide death. There is a sense of comfort in knowing that it is a multinational shared feeling.
Absolutely. And I think it highlights the importance of having these discussions that, we're having today, and just acknowledging some of the unique tensions and aspects that have to be balanced, and some of the important questions that have to be asked that may be quite uncomfortable, but are critical to getting this right for that member and for that family and for that organization in that moment. And that it may be different each time, but having some of those difficult conversations is critical to meeting everyone's needs. And I think that will wrap up today's episode. So I want to thank Matthew and Claudine for participating as our panelists, and Henry for co-moderating. I think it's been a fascinating discussion of both the historical but also the contemporary experiences of how to balance the needs of the various people involved in memorialization of suicide deaths. And I want to highlight for folks who are listening, thank our listeners for participating in this, and then let you know that the fifth and final episode will focus on sort of the what now, some promising suicide prevention practices. And in episode 5, we'll identify promising approaches that show potential for effectively reducing suicide rates and improving support for individuals at risk and their families. So I want to thank you all for listening today, and I hope you enjoy the rest of your day.